Spanberger. The gentleman from California, Mr. Lieu, is recognized to question the witness for 5 minutes.
Thank you, Chairman Bear, for calling this important hearing. Thank you, Dr. Redfield, for your public service, including your service to the U.S. military. The Washington Post published an article. Headline is, "A faulty CDC coronavirus test delays monitoring of diseases spread." So my first question to you is, does the CDC's test for coronavirus work?
Yes.
Okay. What is the error rate on that test?
So we created a test really very rapidly based on the sequence of the virus, within really a week of the sequence being published. And it's a PCR-based test. And the way it was designed at CDC was it actually measures 3 different, if you will, components.
I just need to know the error rate.
Well,
if you know it.
Yeah, the problem was when the test was sent to the states, one of the components had a contaminant in it. That's what had to be corrected. The test at CDC works fine. When it was given to a manufacturer to scale up for the states.
Has the CDC fixed it?
It has been corrected, and there are tests that are being shipped out as we speak.
Okay, so in fact, the first test didn't work.
First test works because it was developed at CDC, and it works fine. We test everyone in the country. When the manufacturer scaled to send to the states, when the states got it, it could tell positives, it could tell negatives, but because of one of the contaminants in the control, there was another group that was, we don't know if it's positive or negative. It was inconclusive. And at that time, the FDA requested that we not use that test and have people send it to CDC, where the initial lots that we made were quite functional and there was no contaminant, and that's the test we continue to use today. There are now over...
Right, so I just need so the current test works.
Current test works.
Okay, great. So it's been reported now that 48 countries have coronavirus cases. In Italy, it's skyrocketed now to 650 cases. South Korea has now 1,700 cases. As you yourself stated, there are more new cases in South Korea than in China. Why is it that we're only testing people who have traveled to China? That seems to make not a lot of sense to me.
Well, when this outbreak originally occurred,
no, I'm talking about right now, not when it occurred. Right now, why aren't we testing people who have traveled to South Korea, traveled to Italy, traveled to the 11 European countries where there are now coronavirus cases?
We're continuing the travel restrictions that were initiated.
No, I'm just talking about testing people. Why don't you expand the test? Because there's a person in Northern California that doctors recommended get the test. And CDC said no, because the person had to travel to China. That's just really stupid, because we know this has expanded way beyond China. 48 countries, every continent except Antarctica has these cases. We really should be testing people, not just those that have traveled to China. Can you commit to expanding the test to beyond those that have just traveled to China if they have the symptoms that look like they have coronavirus?
Congressman, I mentioned earlier, I think before you were here, just so you know, we initially had a geographic restriction. We have changed that. We've posted there's no geographic restriction, that if a clinician or a health department official considers coronavirus in the differential diagnosis, that now meets our criteria.
When did you make that change?
We made that, well, yesterday we did it and we posted it today.
Thank you for making that change.
Yep.
Okay. So in terms of transmission, because earlier you said people shouldn't be afraid. My understanding, based on the articles, Reuters reported that coronavirus contagion rate makes it hard to control. And there are these 2 scientific studies that show essentially each person infected with coronavirus is passing the disease on to between 2 and 3 other people on average at current transmission rates. And then if you've got this long incubation period, potentially 14 days or more, you could have an exponential explosion of cases rather quickly, such as in Italy. Isn't that correct?
I think we've seen that obviously in Italy, Korea, and Iran, and yet.
So this person in Northern California who didn't travel to China, where we don't know where he got the coronavirus, he could have passed on to 2 more people, who passed it on to 2 more people, who passed it on to 2 more people. So there could be a whole cluster of cases. But until as of yesterday, we don't know, because we weren't testing anyone who didn't travel to China. Am I understanding this correctly?
The current public health evaluation of the case in the chairman's district is being led by the state public health system of California, and we're supporting it. We have a large number of contacts that have been evaluated, that are being isolated, that are being tested to really look at the fullest extent of the potential transmission around that case.
Thank you. I'm going to conclude by saying Donald Trump has attempted to minimize the coronavirus outbreak. There's an article in the Daily Beast titled Coronavirus may explode in the U.S. overnight, just like in Italy. I request that when the data and science contradicts what Donald Trump says, that you follow the data and the science. I yield back.
Yeah, I can just say that I commit that CDC is science-based, data-driven service organization, and that's one of the prides that I have to be the director now, to be in a science-based, data-driven, but most importantly, service organization.
Thank you.